For the first set of techniques, we need to locate the region of our masseter muscles. To do this, place your fingers towards the back of the cheeks and jawline like so. Gently clench and release your jaw a few times over, and you'll feel the masseter muscles engaging beneath your fingers, and that is the region that we're aiming for. Using the base of the thumb and palm of your hand as shown, apply firm but comfortable inward and upward pressure in the region of the masseter muscles and below the cheekbones. Remember, it doesn't have to be painful to be effective. Allow your hands to slowly move upwards as the skin and tissues move beneath them. As your hands move slowly upwards, start to gradually open the jaw, and continue this motion all the way up and over the top of the ears. Take your time, relax your breathing, and allow the movement to occur naturally. Repeat this as often as you feel it helpful, or approximately 3 to 4 times. Using both hands, take your thumbs and roughly in line with your lips, hook into the belly of the masseter muscles and place your fingers behind your head as shown. Gently pull your thumbs backwards into the muscle. This will likely cause some low-level discomfort that you might describe as a dull ache, tenderness, soreness, or even tightness. If it's too intense or verging on painful, you're applying way too much pressure. Back the pressure right off and find a comfortable level of pressure that you can work with. Remember that you are in control. Once established, hold that level for a period of time and relax your breathing. You may feel that after a short period those sensations felt at the start have already started to diminish or may have gone completely. When you're ready, slowly begin opening the jaw in small steps and only as much as you're able to, ensuring that you never push through pain, and then slowly close. This technique focuses on the anterior belly of the digastric, the mylohyoid and the genohyoid muscles. Take one hand in a thumbs up position as shown and place the thumb underneath your chin just on the edge of the jawline. Hook your index finger over your chin for support. Slowly glide your thumb towards the body using gentle upward strokes. Ensure that the pressure is always comfortable and that your breathing remains relaxed throughout. Repeat the strokes as much as you feel beneficial, or approximately 10 to 12 times. A simple but very effective and well-known stretch for the tongue. Place the tip of your tongue on the back of the bottom set of front teeth. Push your tongue out of your mouth, keeping the tip of it in contact with the bottom set of teeth. Try to imagine your tongue as a wave shape pushing from the back of the tongue forwards. Hold this stretch for as long as you feel beneficial and comfortable, or approximately 15 to 20 seconds at a time. You can also add sounds such as a low sigh or low and comfortable descending notes while performing this stretch. It may increase the stretch sensations and help to reduce the association of tongue and laryngeal movement. This stretch focuses on the muscles and tissues situated on the front of the neck and submandibular region. Take both of your hands and place one over the other at the top of the sternum as shown. Apply gentle but firm downward pressure taking up the slack of your skin. You may even feel a slight stretch at the bottom of your neck region when doing so, and this is absolutely fine. While keeping the jaw closed but relaxed, slowly and gradually tilt your head backwards while maintaining the downward pressure on the sternum. As you tilt your head backwards, you'll feel the stretch sensation start to increase. Only go as far as you're comfortable, and when you reach that point, stop and hold the stretch for a few seconds with relaxed breathing. Then, slowly and gradually protract your jaw by pushing your chin upwards. Stop when you feel a stretch that is comfortable for you to hold for approximately 5 to 10 seconds. Relax the jaw and repeat as you feel beneficial, or approximately 2 to 3 times before relaxing entirely. The second version of this stretch focuses more attention on the lateral muscles and tissues of the front of the neck and submandibular region. Taking the same steps as in the previous version, but instead of protracting the jaw, slowly and gradually drop your head to one side until you feel a comfortable stretch on the opposite side of the neck. Play around with this stretch by moving your head position to find a stretch that suits you best. Always relax your breathing and hold the stretch as long as you feel beneficial and comfortable, or for approximately 20 to 30 seconds. Then repeat on the opposite side.